uh, talk about eating disorders and have an insight into eating disorders. So to achieve our goals, we are going to use the following plan. First, we are going to give the definition of eating disorders, their characteristics, the types of eating disorders, their causes and risk factors, but also the symptoms and warning signs, the health consequences, the treatment and management, and then we are going to have a short conclusion. So, what are the definition of mental disorders? Mental disorders are serious mental health conditions um, with abnormal eating habits, and so these are habits that can negatively impact the physical and mental health of the people that are affected. Um, we have several characteristics of these eating disorders, starting from the long-standing behavioral issues. These disorders they developed over a long period of time, so they are ingrained in these people behaviors. So they are very difficult to remove except when we use targeted interventions. So there are other factors like biological factors, emotional factors, psychological factors, interpersonal factors, and social factors that we are going to discuss in the next slides. First of all, we have three different types of eating disorders. We have anorexia nervosa, bulimia nervosa, binge eating disorder, and we are going to describe these three in the next slides. uh, what is the first type of eating disorder? Anorexia nervosa is individuals who have fear of gaining weight. They have they are not satisfied with their body image. They have restriction on food intake. There are people who say, I don't want to eat this food, I don't want to eat that food because I'm afraid of gaining weight. These people can be they can dangerously lose weight, but for them, they are afraid of gaining weight. For them, they are overweight, but these people, while they are dangerously overweight. And the second type of eating disorder we have bulimia nervosa. Bulimia nervosa is people with binge eating episode. What is binge eating episodes? It's people who have sometimes these episodes. They eat a large quantities of food in short periods. So sometimes they hide to eat. They know that they don't have control over eating habits. They eat a lot. So what they do is to compensate. They have compensatory behaviors. So after eating large quantities of food, what they do is they provoke vomiting. Sometimes they use fasting between these episodes, and they use excessive physical exercise so that they don't gain weight. So because these people they eat a lot, but they compensate by vomiting, by fasting, by physical exercise, these people can maintain their normal weight. And we have the last type of eating disorder, which is binge eating disorder. This one is characterized by people who have recurrent episodes of eating large quantities of food. They eat very quickly to the point of discomfort, but they have no purging behaviors. With binge eating disorders, these people they eat large quantities of food, but the difference here is that they don't compensate. You see somebody eating lots very quickly. They eat even when they feel they are full. They continue to eat because they feel that they have lost control over their eating habits. So these guys they eat a lot, but they don't compensate, and that is the difference. The compensation is the difference between this one and the previous one. So, what can be the causes and the risk factors of these eating disorders? First of all, we have genetic factors. People who have family members who had these eating disorders are very likely to develop them during their lifetime. And there are also psychological factors. It's people who have low esteem, people who want to have like a perfect body, who say, "Oh, I don't want to eat because I want to be thin," or people who have impulsive behaviors. There are also socio-cultural factors that can affect these people that can drive them to have these eating disorders. So, for example, social pressure to be thin. In some cultures, they say, okay, to have a perfect body, you have to be thin. You don't have to be overweight. And you also have the media. You have the media that is here portraying the ideal body weight, saying somebody should have a body like this. And these guys, they are influenced by these images and they try to modify their diet by adopting these behaviors. And we have also cultural norms. The cultural norms, in some societies, they to have a perfect body, you have to be thin. But in other societies, you have to be like you have to be big. That is why some people in some eating disorders, the patients they don't eat. In some others, they eat too much. And you have the biological factors. When you have imbalances in brain chemicals, like imbalances of the secretion of serotonin, and you have also hormonal influences, hormonal changes the during puberty, for example. These changes can arise during puberty and then influence these people and then drive them to have these eating disorders. You have also stress hormones that can contribute to eating disorders, and you have also many other factors. And what about the symptoms and the warning signs? How can we know that somebody has an eating disorder? Somebody has an eating disorder, for example, for anorexia nervosa. When you see them, they have extreme weight loss. They lose weight and they are worried about food. You always hear them say, "Hey, I don't want to eat this. Hey, I don't want to eat this food. I don't want to eat that food." They are always trying to diet, and they are worried about their body size. This is a symptom to tell you that this guy has anorexia nervosa, and they refuse to eat certain foods. And also they're always exercising. You ask them, why are you doing physical exercise? They say, it's because I don't want to gain weight. The symptom of bulimia nervosa is what? When you see somebody with evidence of binge eating. What is binge eating? Is like people who have episodes. During these episodes, they eat a lot, they eat very quickly, they eat large quantities of food during this period. This is what we call binge eating. And to compensate what they do, they go very often to the bathroom after every meal because they even use laxatives uh, so that they can evacuate what they have eaten in order to avoid gaining weight. So they also have signs of vomiting. They always want to, when after eating a lot, they want to provoke vomiting so that they can, uh, so that they avoid being overweight. They have weight fluctuations. These fluctuations is what? Sometimes you see them, they are very slim. Sometimes you see them, they are very fat. Because if you eat too much, you don't exercise, you don't compensate, then you end up being very fat. But if you do you eat too much, but you compensate by vomiting, even you use laxatives, and even you go to the bathroom to say, oh, okay, let me try to, to compensate what I have eaten. So you do a lot of physical exercise, you end up, these guys, they end up being slim. So that is why you have weight fluctuation. Sometimes they are very fat, sometimes they are very slim. Uh, the third one is binge eating disorder. In this disorder, people eat large amounts of food in a short period, but they eat in secret. They don't want people to see them eating. They know that they have lost they have lost control over their eating habit. So they know that what they are eating abnormally, so they hide sometimes to eat. They feel that they don't have control over their binge episodes. They are ashamed of it, and they have guilt. These guys, they don't compensate. These guys are always eating. They don't compensate. So that is why that can lead them to have serious uh, health problems. And what are the health consequences of these eating disorders? Um, for anorexia nervosa, you have severe malnutrition. Remember that those uh, who have anorexia nervosa are those guys who don't eat. They may be underweight, but they don't believe they are underweight. They don't eat. So this can lead them to have severe malnutrition. And this can also have heart problems. Somebody who is always worried, I'm afraid of gaining of gaining weight, or of getting weight. So this can cause them heart problems, and that can also lead them to bone loss, muscle weakness, because they don't eat, and in extreme cases they can even die. Somebody who for himself is obese or is overweight, while he's dangerously underweight, he's not eating. This can easily lead to death. The consequence of bulimia nervosa is what? Electrolyte imbalances, gastrointestinal problems, dental issues, heart complications. Remember, these are the guys who eat, but they they end up, they end up uh, they end up compensating. So when they compensate, this is where you have these electrolyte imbalances. You go and you eat, and then you eat too much, and then you provoke vomiting. Then this can create, when they use, for example, like laxatives, this can also provoke gastrointestinal problems. And dental issues are provoked by the fact that uh, these guys, because of the acid in their stomach, and heart complications. There are people who are always worried about just somebody who has guilt, somebody who is ashamed of himself, is somebody who is mentally unstable and may have heart complications. And the health consequences of being a eating disorder. Remember that being a eating disorder, these guys, they eat too much, but they don't compensate. They even hide to eat it. They eat secretly. Somebody who eat too much, who have episodes of eating too much large quantities of food in a short period, what happens to this guy? That is why you have obesity, because they eat too much, and you have type 2 diabetes. They eat too much. High blood pressure, heart disease. That is why this kind is also very dangerous, because it can lead you to uh, diabetes and severe cardiovascular diseases. This is being a eating disorder. They eat too much, but they don't compensate. Now, how do we manage or treat these eating disorders? Uh, we have we can use psychotherapy, like cognitive behavioral therapy, like we can help the person to control their eating thoughts. It's like it is these behaviors, these eating or disorders, they are mental before being physical. That is why we have to use psychotherapy, a cognitive behavioral therapy, to help these guys get out of these troubles. So we have also medical care, monitoring and treating health complications. You see, somebody who eat too much, large quantities of food in short periods of time, and then don't compensate, they become obesity. You have to monitor and treat obesity, cardiovascular diseases, and diabetes. These are the complications created by these eating disorders. They need nutritional counseling. If they guys must work with counselors to develop a healthy eating habits and medication also. This guy antidepressant and other medication because uh, they are always worrying to gain weight. They have uh, they, they fall into depression. So it is essential to use antidepressants because somebody who is very dangerously underweight, I think that is overweight and refuse to eat um, and refuse to eat in fear of getting being obese or overweight. This is somebody who has a mental problem that must be treated with antidepressants. And now we go to our conclusion. Uh, to say that eating disorders require comprehensive treatment. It's not like you are going to use one treatment. We must have a comprehensive treatment and support from family, from friends, and from medical professionals. And we all must also detect these eating habits very early so that we can improve the outcomes of the treatment. Thank you for your attention. This was like this short presentation about eating disorders. So your questions will be welcome and thank you for watching.
Yeah, thank you so much, Dr. Diallo, for the wonderful presentation. Yeah, so if you have any question pertaining to the presentation, you can either you will leave it in the comment section for us to read it out so that you can answer. Or better so those with the platform can also bring up the questions by voice anything. Yeah, so yeah, hello.
Hello.
Okay,
Yeah,
okay. Thank you, Abdullah. Thank you for the presentation. I hope that you are getting me right now.
Yes.
I did not get what the previous one was talking about. Thank you for the presentation. And this is an issue, exactly the eating disorder that you're observing across the world. It's not only for developing countries, but it's only also for countries that are with low incomes. And I have something that I want to understand regarding people that have been uh, observed with cholesterol issue and who have decided to stop eating some foods and who have decided to control anything that they are eating and also to do physical exercises so that they can stop getting weight. So where do you put these kind of people who has decided to moderate, to control what they are doing, they are eating, in order to avoid the consequences of high cholesterol in the body, like a stroke or like a heart attack disease? That are my question. Thank you very much for the presentation, which is highly appreciated on my side.
Thank you. Mm. Okay, let me go to the slide. It's like it's like the other slides are not coming. Ah, okay. Yeah. Oh, present. Okay. Thank you, doctor. Um, for someone who had high cholesterol and who decides like to reduce uh, what is eating or eating foods that are of lower cholesterol. This is not, we will not categorize this group as people who have eating disorders because we this is medically in term medic this is medically right oriented. Somebody uh, who had high cholesterol and decide now to eat uh, either foods that have low cholesterol or to reduce what is eating. This is uh, medically justified. Uh, Somebody who has eating disorders is somebody who has no justification. Somebody who has a problem in his mind to say that okay, because I see in a television that to be fit or to have a perfect body, I have to be slim, I have to be thin, so I am not eating. Sometimes you find that this guy is is underweight, but they refuse to eat, or sometimes they eat too much. So this is what we call disorder. Disorder is when it becomes disease. So when it is not, uh, it is medically motivated. Uh, we don't call it, uh, a disorder. That one is not a disorder. We cannot categorize it in either of these three eating disorders.
Okay, thank you for that clarification. This brings me to another question. What is the background, the situation across the world? You did not introduce on that so that we can have a picture and understanding of the eating disorder globally.
Yes, I did not include AP data here. So across the world, if you see that there are socio-cultural factors that affect these eating disorders. For example, in Africa, for most of the time, you see people they want to be to gain weight because if you gain weight in Africa, they say, "Oh, the guy has is now a boss, so he's rich now." So psychologically everybody wants to gain weight in Africa, in African societies mainly. But in the West, people want to lose weight. People want to lose weight. So somebody who is overweight would like to lose weight. This person can easily fall into the first type of disorder, which is anorexia nervosa. uh, he refuses to eat and then he wants to lose weight if until he becomes dangerously underweight. So I don't have the data here, but these are the two tendencies in uh, low income countries like Africa mainly. People these social cultural factors affect people to be uh, overweight, to have a bulimia disorder. But in Western countries, it affects them to have uh, anorexia nervosa. So I don't have the data here, but these are the two tendencies in rich and low income countries.
Thank you.
Thank you. Thank you for it. Next time we will include uh, you know the data in the slides to see what is the situation in Africa and around the world.
Yeah, we are waiting for further or additional questions. So if you have any question, can either leave it in the comment section for us to read out or you go ahead and ask.
Any other question?
Hello, Doctor. Good evening.
Good evening, sir.
Uh, I just want to get this slide. Can I get it, or how can I get it?
Get
This this PowerPoint.
yes, I can send it to you. Just send me a you know send me a message so that I can know it is you. Then I can send it to you.
Okay, thank you.
Thank you.
I'll do that.
Thank you. Okay. Any other question, please?
Hmm?
Yeah, there is one question in the chat session, private chats.
Okay. There is Peter who asked what are some of the hormones that contribute eating disorders and can hormonal therapy be effective in addressing it? There are mainly two hormones, for example. The stress hormone is one of the hormones that are responsible for eating disorders. You know, when somebody is overstressed, when somebody is under stress, uh, that can lead to eating disorders. And number two is uh, disorders in the secretion of serotonin. Serotonin is the hormone, is the pleasure hormone. When your body does not, you know, uh, have enough serotonin, that the secretion of serotonin is like not adequately, you don't have enough serotonin in your body. This can also lead to eating disorders. These are the two hormones. But saying that hormone therapy is not, I don't think it is. Um, yes, for serotonin, yes, you can use hormone therapy because this is a lack of serotonin in the organism. Then you can, you know, but for the stress, you have to manage your stress. There are several ways to manage stress, uh, so that it cannot cause you, health problems. So the two hormones, you have the stress hormone and you have serotonin. For serotonin, I think yes, we can use uh, hormone therapy. But for this one, for the stress, you have to manage your stress. Yeah. And then, okay. Somebody asked if they can get the PowerPoint. Okay. We will get you the slide. Okay. Okay.
Yeah, the session will come to an end shortly. If you have any other question, we are given a maximum of 2 minutes for you to ask so that we will bring the session to an end. Okay, so as we await the possibility of further questions, this is a brief information about us. We are Global Health Insights and Education. We are an NGO much more tailored to promoting global health outcomes through dedicated research and education. We are currently trying to operate on the global scale to reach out to everyone to address major health challenges across the world. That is basically about global health insight and education. You don't see additional questions, so thank you so much, Dr. Diallo from Guinea, also the Assistant Director of Health Education for Global Health Insights and Education. We thank you so much for the wonderful presentation.
Thank you, sir.
You're welcome, and all able executives on the platform, I acknowledge your presence, community out. I see the presence of our Director of Research. I also see other able executives on board. We acknowledge your presence. Thank you all. Hope to meet you another time during our webinar sessions. Bye bye.
Thank you. Bye bye.
Thank you. Bye bye.